Hello, my name is Mark Powell. I'm a registered nurse at West Valley Detention. I've been here for 7 months now. I come down from Patton State Hospital. I was agency staff and decided to take a full-time position with the county, move out of agency since COVID. My background was, I was a CNA, did that for 5 years, became a LVN for 15, and then I got my license in 2020 as an RN. Looked at the county hospital in the ED in trauma, decided that it wasn't what I wanted. The anxiety level was too high, just needed a change of pace. So that's what led me to Patton, and then Patton led me to West Valley. The biggest challenge of landing this position was the intimidation factor of actually deciding, did I want to be in a jail for my job? And it's actually not bad. It's kind of like a little mini clinic. You talk to them, you have to have some social skills. Talk to them and just get through the sit call, and then you have physicians that help you out throughout the day if you need help. So this facility, the safety component is, I feel so much safer in this place than I did in the hospital. In the ED, I could be dealing with I don't know who. In this facility, I have a deputy with me all the time. If something happens, the deputy intervenes. But you know what? I can't even count. I couldn't even tell, maybe a couple times that I have had an incident, and it's just they get loud, they yell. But patients yell at you all the time in the hospital, so you don't have a deputy with you in the hospital. You have 911. Take some time. You might have a deputy in the hospital, but he might be on another call. Who knows? So. Tons of deputies. You have staff that helps you. If you get stuck on something, you can call somebody. Hey, I need some help doing this. They'll come and help you. So it's actually it's a fun little gig. I like it.
Hello, my name is Jessica Nieberge. I'm an RN2 here at West Valley Detention. I am also a new grad, but not new to nursing. I've been a nurse for about 14 years and now a new grad RN for 7 months here at West Valley. My background comes from skilled nursing. I did that for about 5 years. I also did private clinics with a dermatologist doing skin cancer removal, as well as I also worked for Kaiser Permanente in their emergency department, their outpatient wound care, and their urgent care. The move that I made here to West Valley Detention was for a lot of reasons. One was patient care and connecting with my patients. As I've seen skilled nursing for many years, skilled nursing, you're just trying to make it through your day, passing out your meds, looking at labs, and just trying to make through accommodating over 30 patients. As far as for my time in outpatient and inpatient hospital, I found that also my patient care, I wasn't connecting with my patient. Most of my time there was trying to meet quotas, proactive cares, and it was more about hitting numbers than it was for patient care. Here at West Valley, I'm actually able to connect with my patients. It's a different population, but a population that requires a lot of education. If you're somebody that's interested in educating your patients and connecting, this is definitely a place for you. As an RN here and a new grad, I have the support I need from providers, from other registered nurses with experiences from labor and delivery, emergency care, skilled nursing, in order to better attend my patients for things I may not know as a new grad. Here at West Valley, also, it's like running an urgent care yourself as an RN, except you do have the backing of your providers during the day. And at night shift, you actually can call the emergency department of the county and get support you need for your patients. As far as security, that was a thing that I was worried about when I started here. And actually, I feel safer here than I did ever in skilled nursing. In skilled nursing, I found they just wanted to keep a bed occupied to get paid. Here, I have a deputy with me throughout my whole shift. And you find that your patients actually appreciate the education and the time that you spend with them in managing their care. You wouldn't believe how much this population does not know about their bodies and about their disease processes. As a nurse here, you actually become a very big health educator in how they can manage themselves when they're here and when they get out. And you find that the population here really appreciates you. I didn't feel that in outpatient or inpatient care. It was more coming in, getting out, It wasn't sitting with your patient and getting down to why are you here? What is it that you need? Let me educate you. Let me tell you what you need to do to help yourself, and let me help you. That is my experience here at West Valley Detention, and it's a place I plan to retire. And as far as for a new grad, it's a very welcoming place. They're willing to train you. They're willing to help you with anything that you need. And as a new grad, I felt everybody was telling me you need to get your experience. You need to get your inpatient experience. I don't feel that that has hindered me in any way from the care that I provide today. Seeing that my patients love the way that I do treat them, and I have my providers and other RNs here willing to help me.
My name is Janessa, and I'm a sheriff's nursing supervisor. I've been with the department for 4.5 years. I was a nurse assistant prior to getting my registered nurse degree. I started with the sheriff's department as a new grad. At the time, I wasn't able to find a position at a hospital. What brought me to apply for the sheriff's department was the pension, the benefits, the salary. Working inside corrections, it can be intimidating because it's a lockdown facility. However, you're always with custody staff when you see patients. What I really like about working here with the sheriff's department is the autonomy of being able to see patients and treat them based on your assessment.
Hi, my name is Champagne Valencia. I am a licensed vocational nurse here. I've been a licensed nurse for 10 years. I've been here at the county facility for about 1.5 years. I got introduced to working in correctional nursing during COVID. This is not a space that I thought I would be in. Considering my background, I am a victim of sexual assault and abuse, so this is the last place I've ever thought I would work. But I keep showing up because I noticed that my personal empathy has broadened. Being in this environment, it challenges you. You're faced with the consequences of, daily untreated mental health, substance abuse disorders, and outright shame. And being able to provide somebody care and dignity requires a certain level of professionalism that will make anybody a superhuman. And that's why I keep showing up. I enjoy the staff. I enjoy working with custody. I enjoy being a part of somebody's medical care. A lot of these inmates don't realize they have underlying medical diseases until they come to these facilities. So being able to grant somebody help and care in this time of need, it just really fills my heart. It makes me feel like I'm doing a good job and I'm showing up and I'm proud to be here every day.
Hi, my name is Lanni. I work here at the Sheriff's Department of San Bernardino. I am the charge nurse at this facility. I work here, I'm going now on my 16th year. And that says a lot why I love to work here. I used to work in a hospital. I also worked there for like 16 years. Here, you're dealing with a different kind of population. It's something you don't get when you work at the hospital. One thing I like working here is that there's a camaraderie between the nurses that work here. I encourage you, if you want to try another aspect of nursing, this is a best place to experience that. Thank you again, and I hope to see you all here.